A treatment plan template is a structured document that mental health professionals use to plan and guide the treatment process for their patients. It is a tool that promotes organization and clear communication between the patient, the therapist, and other healthcare providers involved in the patient's care. A well-designed treatment plan template will be both comprehensive and specific. It covers all aspects of the patient's care, from the presenting issues and diagnosis to the goals, interventions, and medication details. It's a list of what will be done and a tool for documenting why these steps are being taken based on the patient's unique needs, strengths, and challenges. The treatment plan template is also a dynamic document that evolves. It's not set in stone. Instead, it's reviewed and updated regularly to reflect the patient's progress and any changes in their needs or circumstances. A treatment plan template is not only for when a mental health professional initiates therapy with a new patient, but also serves various purposes throughout the therapeutic process. To use our free treatment plan template, follow these steps. Download our free treatment plan template from the Carepatron platform, which you can find in the link in the description. Firstly, gather patient information. This includes the patient's name, date of birth, and the initial assessment date. Next, record presenting issues. These are the symptoms or concerns that brought the patient to therapy. Next, setting treatment goals. Goals should be SMART, specific, measurable, achievable, relevant, and time-bound. Next, identify interventions and strategies. These are the specific therapeutic techniques or methods that will be used to achieve the treatment goals. Next, specify therapeutic modalities and frequency. This section outlines the type of therapy used and how often sessions will occur. Next, detail medication. If medication is part of the treatment plan, the template will include a section for this information. Outline a crisis plan. This step includes signs of potential crisis and steps for intervention. Obtain consent and explain confidentiality. The template will include a section where the patient can provide consent for treatment and where the limits of confidentiality are explained. Review and adjust the plan. The treatment plan should be reviewed and updated regularly to reflect the patient's progress and any changes in the treatments needed. Finalize the signatures. The templates have a space for the therapist and patient to sign acknowledging agreement to the plan. Here is a sample of our treatment plan template, which you can find on our Carepatron platform. To find our treatment plan template, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.